All right, there is some more hope on the horizon this Friday. At any moment today, we could learn whether or not the FDA will approve Moderna's COVID-19 vaccine for emergency use authorization. Now, an important benchmark in this pursuit was passed yesterday. In a unanimous vote with one abstention, an advisory panel agreed that that vaccine should be authorized. So now it's basically just a rubber stamp as we wait for the FDA to do their part. Going to say good morning to Tiffany Liu, joining us live in Dallas. It was an important meeting yesterday, Tiffany.
Yeah, Mark, absolutely right. You know, yesterday I had my eyes kind of glued to that computer screen, kind of waiting to see what would happen. And the expectation is that the Moderna vaccine is going to get that okay today. It was about 7 hours of debate. Yesterday, a panel of FDA advisors met, and it was a consensus that the benefits of the vaccine outweigh the risk for those 18 years and older. The emergency use authorization should be granted by the FDA rather quickly. Data shows the Moderna vaccine has 94% protection against COVID-19. Now, the company studied 30,000 people in the ongoing clinical trial. And just yesterday, I spoke to a mother-son duo who were part of the Moderna trial in Dallas. They don't know if they got the drug or the placebo, but they are proud to be a part of the study.
If this is what I can do to contribute to ending, the pandemic, then I thought that that's a really good way to give my contribution to the community.
Yeah, I was very similar.
Now, once this is approved, it will be the second vaccine to be approved ahead of the holidays. Again, healthcare workers and long-term care facility residents are going to be among the first to get the vaccine. Let's send it back to you.
All right, thank you for that, Tiffany. So we are waiting for the FDA emergency use authorization for that Moderna vaccine. And you might think that once they authorize it, then they make it. Actually, there are already millions of doses in warehouses just ready to go out as soon as that final approval is delivered. So they're ready to start distributing that around the country as soon as they can. Texas Governor Greg Abbott, he spoke yesterday on just how many vaccines the state of Texas has already received. He also shared his thoughts on a possible lockdown. We're saying good morning to Ariel Placencia, who is live from her home today. What else did the governor discuss during his press conference, Ariel?
Well, Mark, that press conference was held at the big UPS distribution facility down in Austin. And so naturally, the conversation focused on distributing the vaccine. And next to the governor at that press conference was a big package. And we do have some video of it. So go ahead and take a look. UPS is obviously playing a pretty big role in distributing the vaccine. And we learned yesterday, according to a UPS spokesperson, there's up to 5,000 doses in that box, as well as dry ice that's on the top as well as the bottom. Once the vaccines arrive at a location, UPS says they do have to refill the dry ice every so often. Now, as of this morning, over 224,000 doses have been delivered to 110 providers, like hospitals and medical schools across 34 counties, according to the governor. And by the end of the month, Abbott said over 1 million vaccines will have been distributed. Now, we also talked about antibody therapy drugs yesterday, saying he hopes this combination of these drugs and the vaccines will help reduce the number of hospitalizations. Now, speaking of that, COVID patients are still taking up well over 15% of hospital beds in North Texas, and that's the threshold Abbott established for imposing new restrictions. Now, the governor said yesterday it's up to individual Texans to do more to slow the spread, like masking, social distancing, and hand washing. But North Texas doctors tell us they're worried about the short term, saying if we cannot get the virus under control, something's got to change. Even the White House Coronavirus Task Force said this month every state needs to do more to slow the spread and that mitigation efforts must increase, like no indoor gatherings. But when asked about future shutdowns yesterday, the governor had this to say.
People's lives have been crushed, and their pocketbooks and their ability to pay the rent and put food on the table has been harmed because of the shutdowns. And so, no, we will not have any more shutdowns in Texas.
Now, the governor said yesterday he has not yet gotten the vaccine. He does plan to do so. However, he will get it at the appropriate time.